right.
Okay, so essentially to start with the basics, Dr. Pandy sent you here to get the PD catheter placed. That way, when he's ready to start you on the dialysis, you've got a good access, you're ready to go, okay? And by having that access earlier on, it can mitigate any complications down the road, okay? So the PD catheter, it is a surgery to place it. It's a surgery that we do at the hospital here for most patients, the Memorial Hermann Greater Heights. It's considered an outpatient surgery, meaning we don't expect you to have to stay in the hospital overnight, okay? How the day would look for you, so to speak, you would come in and have some labs drawn, some standard pre-op blood work, things like that. The anesthesia team would meet with you and determine the safest drugs to give you. We try to get this done under general anesthesia, meaning you get all the good sleepy drugs to knock you out, so to speak, so you don't feel any pain during, okay? The procedure itself takes less than an hour, probably closer to 30 minutes. Dr. Kihani does a lot of these, he's pretty quick with them. But you can expect, of course, the catheter, you're gonna have a clear tube that extends, and then maybe a little puncture site here, and a little puncture site here up towards the upper part of the belly. And the catheter itself is usually somewhere in the lower part of the abdomen on either side, okay? He does this laparoscopically, meaning he'll put a scope in, kind of look around, make sure everything looks good and the placement of it looks good, okay? After surgery, you'll wake up in what we call the PACU or the post-op unit. They'll watch you for a few hours, and then when you're feeling awake and ready, you go home, okay? And then the steps moving forward, once you are home and it's placed, that's when Dr. Pandy's team and dialysis team, they'll kind of coach you through how to take care of it and what to do next and when to start the dialysis, okay? So we place it, he essentially deals with it and helps you work with it, if that makes sense. Okay. Let's see, any questions so far about the surgery?
Sure. So the PD, where's that? Is it only one access point? Is the one going out?
The catheter?
Catheter.
Yep.
Okay. So that means the tube goes in and then it's in there, but then it goes out with like two pieces. Right?
So you're just gonna have one tube sticking out that has one end on it. No other ports or side branches or anything else complicated like that. Okay. And again, the dialysis nurses will teach you, but when you start the dialysis, that one end point of your catheter, that's where they're gonna hook up to other tubing that's connected to the dialysis machine. Okay.
And you can shower and everything?
You can, you'll just have to keep it covered.
Keep it covered? So people has been telling me that doing that is more chance of infection than doing in-house.
So there is a chance of infection. That's a very good point. There is a chance of infection anytime we put anything artificial in the body. So we have to weigh the risk versus benefits. And I would say the reason Dr. Pandy kind of recommended or steered you towards PD is because you're a bit on the younger side, more independent, and this may give you a more normal lifestyle, okay? A lot of our younger patients tend to choose PD.
But then I have SLE lupus, you know? So that I think that's what makes me worry and them worry, because then with my lupus, would that be more chance of me getting infected if I'm at home?
Yeah, you know, it just depends. It just depends on your immune status. Some patients with lupus, their immune status is still fairly robust. Other patients not so much. It just depends.
Yeah, I have low blood. So I, as of 3 years ago, I stopped going in every 2 months for blood transfusions.
Yeah. And that's something, when Dr. Kihani comes in, he may be able to give you a better finite answer to the actual risk of infection. The risk is always there. It just kind of depends on what you'd want to do.
Most people prefer the in the clinic. Do you know?
Most people, like you, meaning relatively healthy,
Yeah.
you know, up, walking around, doing your own thing, fairly independent, most prefer PD, so you could stay at home and do it.
Do it yourself.
But
and everything.
everyone's different. But that's what I see most commonly.
Most common, and it's more freedom.
Exactly.
More freedom, and then what do you call it? If what happened if I changed my mind, I wanted to do the other one. Is that something that can be done?
It can. That PD catheter is not permanent by any means. If you change your mind, we can do a procedure to take the catheter out and place a fistula or an access in the arm to do the in-center dialysis. We have patients who change their minds all the time.
Okay, so yeah, because that the other one, the fistula, it sounds like it takes a longer time to heal in order to do it, right?
It does.
It
Yes,
does, right?
ma'am.
And
It does.
how long compared to the PD?
Weeks to months longer.
Oh wow, weeks to months longer.
Yes, ma'am.
And let's say mine completely dropped, then that's not gonna be on time for that, right?
Correct.
Oh, that's not good.
Correct.
Okay.
And the whole point of placing something in you early on is to prevent you from having to get a catheter in the chest. Nobody wants a catheter. Those are very high risk for infections and for issues with the veins in the chest.
In the chest.
Yep. So we don't want to do that if we don't have to.
Okay. And the thing I'm worried about is that my veins are so small because I've been poked since I was 21.
Yeah.
So is it able to do it?
It's a possibility. Down the road, if you chose to do it, we'd have to do some testing on your arms and on your veins. And then also, we do find that patients with lupus in particular, due to changes in the blood, it makes you more prone to clotting, at least some patients. And some patients may have issues with the fistulas. Not every patient, but some do.
Can you the fistula, can you bend? You can?
You can.
I don't think I'll have problem with the clotting because I have low platelets.
Okay.
I don't clot. So that's a good, I never knew I would say it's a good thing, but I can't clot.
Yeah, and you know, lupus is such a fickle disease. Everyone's different. But But a little more about your history. Other than the lupus, nothing major, no heart attacks, no strokes.
No,
that
nothing
I'm
like
aware
that.
of.
Partial seizure.
The seizures. Any surgeries on the belly before?
Splenectomy.
Splenectomy.
When I first got diagnosed, I did a splenectomy.
Okay, was it a
Because then it was like, let's see if that would help my blood count go up a little bit. So that I have that surgery.
Okay, how long ago was that?
Probably 22, 23.
Okay.
Yeah.
When they did it, did they make like a big cut on you, or do everything through
Laparoscopic.
little? Okay.
Laparoscopic.
Let's take a look.
Sure. I think I could turn this off now for now.
Yeah.